supervisor in Peking University Cancer Hospital and Institute. Her area of research interests are efficacy, evaluation, and mechanisms, elucidation of anti-cancer herbal medicine, overcoming drug resistance by integrative medicine. She has published more than 25 papers in reputed journals. Welcome.
Good afternoon, ladies and gentlemen. It's my pleasure to present our study here. The title of my presentation is Enhancement of gefitinib-induced growth inhibition and apoptosis by Marsdeniatenacissima extract in non-small cell lung cancer cells expressing wild or mutant EGFR. Okay, first let me introduce the background of our research. We all know lung cancer is the leading cause of cancer deaths worldwide. Non-small cell lung cancer accounts for 75 to 80% of all lung cancers. Epidermal growth factor receptor is overexpressed in up to 80% of non-small cell lung cancer and become a promising target for anti-cancer therapy. Gefitinib, the treatment is Iressa, has demonstrated clinical efficacy in non-small cell lung cancer patients harboring EGFR mutations or refractory to chemotherapy. It competes with ATP for the binding sites at the tyrosine kinase domain, thereby dampening the phosphorylation and activation of EGFR so as to the downstream signaling networks. Although gefitinib has demonstrated clinical efficacy, however, the responsive cases eventually develop the resistance to gefitinib. Meanwhile, most of non-small cell lung cancers are with wild-type EGFR, and only 10 to 20% of non-small cell lung cancers respond to gefitinib. Therefore, how to improve gefitinib efficacy and let more non-small cell lung cancer patients can benefit from tyrosine kinase inhibitor therapy is still the goal of physicians and researchers. Marsdeniatenacissima, which mainly produced in Yunnan province of China, has long been used as a remedy to treat cancer in China. This is the plant of Marsdeniatenacissima. More than 40 steroidal glycosides has been isolated from the stem of Marsdeniatenacissima. According to our previous research, the water extract of Marsdeniatenacissima, later referred to as MTE, could restore gefitinib sensitivity in the resistant non-small cells. And the result was published in the Journal of Lung Cancer. However, whether the effect of MTE in the sensitive non-small cell lung cancer cells is same as it in the resistant one is unknown, and whether the mode of action of MTE show difference or just the same in gefitinib sensitive and resistant non-small cells. We want to discuss it. Okay, the methodology and the main content of our research are as below. Firstly, 3 different sequential combinations of MTE and gefitinib on cell growth were evaluated using IC50 and Combination Index approaches. Secondly, the flow cytometric method was used to detect cell apoptosis and the cell cycle profile. Thirdly, the impact of MTE combined with gefitinib on cell molecular network response was studied by Western blotting. From our study, we can gain the results as below. It can be divided into 4 parts. First, the anti-proliferative activity of gefitinib and MTE in non-small cell lung cancer cells. This is the we examined the in vitro cell growth inhibition of gefitinib or MTE on HCC 827 cells. It has EGFR exon 19 deletion, and H292 cells. It is a wild type EGFR. After treatment for 72 hours, the IC50 value of gefitinib for H292 and HCC827 were all less than 1 micromole, indicating they are very sensitive to gefitinib. This is in accordance with other research. We also expose these two cells to MTE. And these two cell lines showed a same dose-dependent tendency inhibition manner on cell viability, regardless of the EGFR status. And the IC50 was very close. Okay, the second part is sequential combined inhibitory effect of gefitinib and MTE in non-small cell lung cancers. Compared with gefitinib alone, okay, the right support is gefitinib alone. All cells treated with gefitinib and combined with MTE exhibited decreased cell viability. As shown in the figure, the CI value, this is the combined index, the value, or less than 1. Less than 0. This is 0. This is -1. Yeah. This part means synergism. Yes. This is additive effect. This is antagonism. We can see they are all showed additive or synergism effect. This is the H292 cell. Another one is HCC 827 cell. We can see the same tendency in these cells, and the effect was more prominent. This means that MTE could enhance the efficacy of gefitinib in these two gefitinib-sensitive non-small cell lung cancer cells. Among which, this one, the red line, M to M plus G, that means MTE to MTE plus gefitinib. The IC50 is very less than the gefitinib alone and the other combination. So we choose this combination to do the following research. So we used cytometric method to determine the cell cycle, and we found that in H292 cells, we can see an increase in G2M phase and a decrease in G0, G1 phase. That means MTE to MTE plus gefitinib caused G2M arrest in these cells. In other cell line, HCC 827, we can see a different condition. Yeah, it caused a G2M decrease and increase in S phase. Although MT combined gefitinib has different result on these two cell lines, but they all cause the cell cycle delay. Yeah, this led to cell apoptosis. Yeah. Okay, this is the statistical result of the apoptotic cells percentage. We can see, from the figure, we can see that treat with MTE or gefitinib alone also induced cell apoptosis significantly. And their combination increased the apoptosis cell percentage further to a very significant extent. This result revealed that this combination was effective in cell apoptosis induction. Next, to investigate the combined effect of MTE and gefitinib on EGFR-dependent signaling pathways, cells were stimulated with 10 nanogram per milliliter EGF for 15 minutes before harvest. Yeah, the PI3 kinase AKT mTOR is the downstream of EGFR, and it is an important intracellular signaling pathway in cell apoptosis, and this deregulated cascade is reported to contribute to lung cancer development and maintenance. Also, the research shows that frequent AKT activation and mTOR phosphorylation were found in 50% of non-small cell lung cancer patients, and in 74% of non-small cell lines. So that we focus on these pathways. And non-small cell lung cancer cell lines responsive to EGFR tyrosine kinase inhibitors with growth factor, with growth arrest or apoptosis showed a downregulation of the PI3 kinase AKT mTOR pathways. So we check the expression of the signal by Western blotting. This is the result. You can say by the stimulation of the EGF, we can see the upregulated of the PI3 kinase, AKT, and mTOR, so as to the phosphorylation of ERK. And the phosphorylation extent is more prevalent in HCC 827 cell lines than H292 cells. However, the activation of EGFR downstream pathways was strongly inhibited by gefitinib treatment. This is gefitinib treatment. This line. Moreover, the inhibition was further enhanced by their combination. Yeah, we can see the inhibition is very, very strong. Need to block it. Other pathways, BMAT, is also related to EGFR activation, and CMAT and EGFR receptors are widely expressed in cancer cells, and they have redundant effects on cell cycle progression, apoptosis, and so on. And they are potential targets for combination therapy. The CMAT receptor tyrosine kinase has been identified as a novel promising target for non-small cell lung cancer. It demonstrated that EGFR activation contributes to CMAT tyrosine. So, other research also demonstrate that there is a crosstalk between the CMAT and the EGFR signaling pathways in lung cancer. So we also check the expressing levels of CMAT and EGFR in these two cell lines. The recent study showed that treatment with gefitinib, this one, abolished tyrosine phosphorylation of c-MET and EGFR. Of course, their combination further decreased their activation. To our surprise, MTE at relative minimal cytotoxic concentration also decreased c-MET and EGFR activation very strongly in the present study. But this result was not shown in the resistant cell line. We didn't show it in these pictures. We present in our published articles. So this picture means that this combination was had a very strong effect to inhibit the p-MET and EGFR phosphorylation. Thus caused cell apoptosis and cell death. Let's give some summary. From our research, MTE and gefitinib acted synergistically or additively with different combinations to suppress gefitinib-sensitive non-small cell lung cancer cell growth over treatments with either agent alone. And this combination, MTE to MTE plus gefitinib, was the most effective one. And this combination induces significant cell cycle arrest and cell apoptosis in non-small cell lung cancer cells. This remarkable cell growth inhibition and apoptosis induction were mostly ascribed to the significant suppression of ERK and PI3 kinase mTOR pathways. From the research, we can conclude that the blocked crosstalk of EGFR and c-MET was also contributed to the prominent anti-tumor effect of MTE to MTE plus gefitinib treatment. And there was no obvious difference between the effect of this combination in EGFR mutant cell line HCC 827 and Y-type cell line H292. Thus, we think MTE is a promising herbal medicine to improve gefitinib efficacy in non-small cell lung cancer, regardless of EGFR status. From the present research, unlike in gefitinib-resistant non-small cells, MTE alone also demonstrated certain unexpected modulation on EGFR-related cell signal pathways in the sensitive ones. But how the different effect of MTE in gefitinib-sensitive and resistant non-small cells need further research, and also we need to get more solid evidence in the carcinographed mouse model. Okay, the last part is the acknowledgement. Yes, thanks for the funding, and thanks for Professor Lee, my tutor or postdoc. Yeah, this is the PhD student. Thanks to our research team. Okay, thanks for your attention.